Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Brief Pain Inventory assesses the intensity and impact of pain in patients with various medical conditions, including cancer, neuropathic disorders, and musculoskeletal diseases. It evaluates pain severity at its worst, least, average, and current levels using numerical ratings. The tool also measures pain interference with daily functions such as general activity, mood, walking ability, work, relationships, sleep, and enjoyment of life. Its main purpose is to quantify the multidimensional nature of pain to aid clinicians in treatment planning and monitoring therapeutic outcomes. The instrument is validated and widely used in both clinical and research settings for pain assessment. The Brief Pain Inventory is indicated for adult patients experiencing acute or chronic pain resulting from cancer or non-cancer conditions. It is particularly useful for populations with heterogeneous pain etiologies, including musculoskeletal disorders, neuropathic pain, and post-operative pain. The instrument is designed to assess both pain severity and the impact of pain on daily functioning. Its clinical utility is most pronounced in oncology settings for evaluating pain related to tumor progression and treatment side effects. Additionally, it is widely employed in pain management clinics and rehabilitation contexts to monitor treatment response and facilitate individualized pain management strategies. The Brief Pain Inventory consists of 9 items designed to assess pain intensity and its impact on daily functioning. The clinician begins by asking the patient to rate their pain at its worst, least, average, and current levels using a numeric rating scale ranging from 0 to 10, where 0 indicates no pain and 10 represents the worst pain imaginable. Next, the patient is prompted to evaluate how pain interferes with 7 domains, including general activity, mood, walking ability, normal work, relations with others, sleep, and enjoyment of life, also rated on a 0 to 10 scale. Responses are recorded as numeric values for each item. To interpret the results, pain intensity scores of 0 to 3 typically indicate mild pain, 4 to 6 moderate pain, and 7 to 10 severe pain. Interference scores are similarly divided, with higher scores signifying greater functional impairment. Clinicians should consider both intensity and interference scores to obtain a comprehensive understanding of the patient's pain burden. Trends in scores over time can guide treatment adjustments. The tool's psychometric properties demonstrate good reliability with internal consistency coefficients above 0.8. The Brief Pain Inventory demonstrates variable sensitivity and specificity depending on the clinical context and the pain condition assessed. Sensitivity refers to the instrument's ability to correctly identify patients who are experiencing clinically significant pain, thus minimizing false negatives. Specificity measures the tool's ability to correctly identify patients without significant pain, reducing false positives. Empirical studies report sensitivity values for the Brief Pain Inventory ranging from 0.8 to 0.9, indicating a high capacity for detecting patients with pain. Specificity values are slightly lower, often between 0.7 and 0.85, reflecting a moderate ability to exclude patients without substantial pain. For example, in oncologic populations, a sensitivity of 0.87 means that 87% of patients with meaningful pain are correctly identified, optimizing pain management decisions. A specificity of 0.75 indicates that 25% of patients without significant pain may be misclassified, which clinicians should consider when interpreting results. These metrics highlight the Brief Pain Inventory's utility as a screening tool while underscoring the need for complementary assessments to confirm pain status. The brief pain inventory was originally developed in the late 1980s by Cleland and colleagues at the University of Texas MD Anderson Cancer Center to quantify pain severity and its impact on daily functioning, primarily among cancer patients. The tool's validation involved extensive psychometric testing across diverse patient populations, demonstrating high internal consistency with Cronbach's alpha values typically exceeding 0.8, and robust test-retest reliability over short intervals. Construct validity was established through significant correlations with other established pain measures, including the McGill Pain Questionnaire and the Visual Analog Scale. Subsequent studies expanded the instrument's applicability beyond oncology to chronic non-cancer pain conditions, maintaining its reliability and validity. Factor analyses consistently supported the bifactorial structure of pain severity and pain interference domains. Additionally, the brief pain inventory has been translated and culturally adapted into multiple languages, with validation studies confirming its psychometric robustness internationally. This body of evidence has positioned the brief pain inventory as a clinically meaningful and scientifically sound instrument for assessing pain intensity and its functional effects in both research and clinical settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.